A very good evening to one and all present here. It gives me immense pleasure to welcome each and every one of you to this special episode held on the momentous occasion of the 25th Silver Jubilee celebration of the Prabodhini webinar series. I feel truly honored and blessed to welcome our guest of honor, Dr.S.Gopakumar, Registrar of Kerala University of Health Sciences. Personally, this moment is very special for me as I had the privilege of attending Sir's classes both during my UG and PG. His teaching style is not only informative but deeply inspiring. So, before handing over this section to Dr. S. Gopakumar sir, I would like to present a brief profile of this esteemed scholar. Dr. S. Gopakumar, Registrar of Kerala University of Health Science, is a highly accomplished academician with an inspiring journey in the field of Ayurveda. He completed his BAMS from the University of Kerala in 1995, securing first rank and a gold medal. He pursued his first post-graduation in Kaya Chikitsa from the University of Kerala in 2000. Later, he completed a second post-graduation in Roganidana from Kannur University in 2008. His academic pursuit continued with a PhD from the University of Kerala in 2019, where he developed an Ayurvedic instrument to assess stress among IT professionals, blending classical wisdom with modern-day relevance. With over 22 years of teaching experience, Dr. Gopakumar sir began his career as a tutor and later served for 5.5 years in the Department of Roganidana at Government Ayurveda College, Kannur. He then worked as assistant professor at Government Ayurveda College, Trivandrum, and later as associate professor in both Kannur and Thiruvananthapuram Government Ayurveda College. He also held the position of professor in the Department of Roganidana at Government Ayurveda College, Kannur. Dr. S. Gopakumar is actively involved in academic and administrative roles at the Kerala University of Health Sciences. He served as the chairman of the Board of Studies in PG Preclinical Ayurveda and as a member of Faculty of Ayurveda, the Academic Council and the University Ethics Committee. Dr. S. Gopakumar sir has been widely recognized for his outstanding contribution to Ayurvedic education and practice, which include the prestigious Bishak Ratna Award 2023 for the Lifetime Achievement and the Shri Dhanvantari Ayurveda Puraskaram 2023. He has also received the Best Teacher Award 2020 from KUHS and the Acharya Award 2017 from CCIM. Other notable honors include the Best Ayurveda Award 2016, the Amrit Mahotsav Dhanvantari Award 2022, the Agnivesh Award 2018, the Tilak Ayurveda Ratna Award 2019, the Dronacharya Award 2018, the Pride of Ayurveda title 2019 from Ayur Central Foundation, and so on. These awards reflect his deep dedication, excellence in teaching, and lifelong service to Ayurveda. He has presented more than 350 papers at various state, national, and international seminars, conferences, and workshops, including prestigious platforms in London, Chicago, Sharjah, Thailand, Moscow, Australia. He has authored more than 15 books and he has published numerous scientific papers in reputed journals, including the International Ayurveda Medical Journal. Apart from academics, Dr. S. Gopakumar has actively contributed to public outreach and community service. He has participated in numerous radio and television programs to promote awareness about Ayurveda. With such an inspiring journey marked by academic brilliance, research excellence, community service, and an unwavering passion for Ayurveda, Dr. S. Gopakumar sir truly stands as a role model for every Ayurvedic student and professional. Now, Without much delay, I feel extremely happy and honored to hand over this section to our esteemed guest, Dr. S. Gopakumar sir. So, my dear students and all the listeners, this is a golden opportunity. So, I urge all of you to keep your eyes wide, your ears tuned in. Let us absorb each and every word of wisdom he shares with us today. Over to you, sir.
Okay, thank you very much. Good evening. Am I audible?
Yes, sir.
Okay, respected dignitaries, respected faculty members, respected teachers, my beloved students. Very happy to be here, especially being the 25th episode of Prabodhini. I pray to Dhanvantari that may this continue in the future, reaching 50th episodes and even 100th episodes, celebrating century. Thank you so much, because such things will happen only when there is real element of dedication. People will be having different programs like webinar series, seminars, or other activity, but there will be a natural end. But from the listeners and as well as from the speakers and when combined with the enthusiasm of the organizers, everything will be fine. I always believe that since Ayurveda has 3 doshas or 3 guna, in every events of scientific propagation, there are 3 components: organizer, speaker, listener. The Samyak Yoga of which will make Vata and Lomadai knowledge exchange, so it will continue. So,
sir, echo is going on, sir.
Echo.
No, sir.
Any problem from there?
I think that on your mobile and system,
No.
both are working, sir.
No. You have joined through the system only. If there are multiple joins, you can disconnect one
Yes,
from the system. I think now it is okay.
Yes, sir. Yes, sir. Done.
Because 2 joinings were there, no? Is it okay now?
Is it?
Yes,
It's okay, sir.
yes.
No, it's okay.
Okay,
No,
thank you so much. Okay, let us come back to the topic. So today I want to discuss with a very important topic, especially for the juniors, making of an Ayurvedic clinician. Actually, I started my career as a teacher in 2000. And now it is 2025. So I will be sharing my humble experiences, which I collected as a teacher as well as a clinician. So I very well know what is the real problem faced by a student when he comes out of the BAMS or even after having a PG, when he is really facing a patient, how he should be intelligently utilize the concepts which he studied in the class. So otherwise, I would like to tell you that my attempt is to reduce the gap between principles and practice in the real sense. You very well know Vata is Ruksha. You very well know Pitta is Ushna. You very well know Kapha is Snigdha. No doubt, you know all these things. You very well know when the Snigdha component in your blood is increased, we call it as hyperlipidemia. Are you following me? When the Snigdha component in your blood is enhanced, we will call it as hyperlipidemia. When the same Snigdha component is increased in the liver, and according to Ayurveda, liver is Shonidavahanam Srodasam Egrit Moolam, we can call it as fatty liver. Same way, when the Snigdha component is increased within the coronary artery, we can call it as atherosclerosis. We may use the terminology Dhamani Pradijayam. As you identify that it is atherosclerosis, you visualize the internal lumen of the coronary artery by an angiogram. Then you will see that there is a possibility of Hridroga, Dhamani Pradijaya, and you will understand from the principle that you have to remove this Rodoroda by a drug which will bring down the cholesterol, which will work in the Snigdha, which will work in the Medho Dhadu. Then you may prescribe Resonas, Lesuna, something like that. So what I am going to tell for the next 1 hour, how you can combine all these things together by which you will be entering into the status of a successful Ayurvedic clinician. So that is my target is well defined. So I will tell you, my dear students, I am calling everyone as student only. I consider myself as also a student, even though I have 2 PG and PhD, I always wish that you should call me as a first year BAMS student. Because when we feel that we are a first year BAMS student, we will never forget Padartha Vijnanam. We will never forget fundamental principle, and we will be remembering every components of Ayurveda with the modern anatomy, physiology, everything. So stay as a first year student, even though you are having multiple degrees. Okay. So the very first thing is my humble request, all of you, please imagine that you are sitting in your consulting room. Please imagine, please close your eyes and imagine that you are sitting in the consulting room and there is a patient sitting in front of you. There is a patient sitting in front of you. Everybody, please imagine. Okay, what you are going to do? First, you have to listen what the patient is telling. They will be telling all the major problems faced by them. They will be telling their signs and symptoms. They will be telling a detailed story. Never interrupt, never stop them. Let them talk in their own way. Once you identify that these are the main issues of the concerned patient, then naturally your right side of the brain should start thinking about the Ayurvedic fundamental principles related. It doesn't mean that you are going to open the Charaka Samhita Sutrasanam reading from the Dirgham Jividiyam. It doesn't mean that you are going to open the Aishkamiyam from the Ashtangridayam Sutrasanam. No. When the patient is telling some signs and symptoms, the primary thing is you identify this can be the area in Ayurveda where you have to locate about the patient. I will tell a simple example. We will be discussing only examples. You are getting a patient with a fever, because jara, that is a very common symptom. And patient is telling that the patient is having jara, but the temperature is not so high. The temperature is not so high. It is around 99 to 100 degree Fahrenheit. And the patient is telling she is suffering from, or he is suffering from rhinitis, running nose, feeling of dyspnea, cough, a little bit of breathlessness, dyspnea, and the fever is somewhat low fever, slight body pain is there. Then what could be your thoughts? What can be your thoughts? Should identify it is a case of jara. And when there is mild fever, something which is related with the Shida Guna will be playing in the curtain. What are the doshas having Shida Guna? Only 2 dosha, Vata and Kapha. Both are Shida Guna. So Shida Guna related doshas, if they are responsible for a fever, the fever will not go to the status of a hyperpyrexia. So there will be around 100 degree Fahrenheit. Then they are telling about the respiratory problem. Sneezing is there, coughing is there, difficulty in breathing is there. So Kasa, Shosa, Pinasa, etc. are there. They are complaining about mild body pain, muscle pain, myalgia. So all these things put together, your brain will tell, as per your fundamental knowledge, the dosha domination of the patient sitting in front of you with the jara can be Vata, Kapha, Jara. Are you getting me? So by analyzing all these things, same time the patient is sitting in front of you, you are not reading Ashtangridayam, Charaka Samhita, Sutrasanam, but you are recollecting the basic fundamental principles by exploring the signs and symptoms of the patient. Because of the low fever, Mandaguna Kapha, Shidaguna Vada, Shidaguna Kapha. So Vada Kaphas are there. Kasa, Shosa, Pradishaya, running nose, cold and breathlessness, cough. Definitely the Kapha involvement will be there. Mild body pain. Without Vada, there is no possibility of my pain. So Vada. So finally, my dear, what will be your clinical conclusion? You will tell that it is a case of Vada Kapha Jara. Okay. Then next moment, you are entering into the status of his Koshta Parisha. That is very important. Because why I am giving more importance to Koshta? Koshta doesn't reflect the general status of the alimentary canal. Koshta gives so vital clues. You have to write a medicine. That medicine should be properly absorbed, digested, and distributed into the system. So the Koshta and Agni status are very much important. So next natural question will be, what about your appetite? How is your Koshta? Then naturally you will be getting some answer by the patient. So you got a very important clue regarding the dosha domination of the case, the Koshta status, and the Agni status. These are the minimum things. Then definitely you can go for certain laboratory investigations, whether there is any positive test for any type of fever or any other modern laboratory findings are there, especially rise in ESR, rise in CRP, because these rise in ESR and CRP may indicate that there can be a dhatu paka, there can be an inflammation. So with this minimum information collected by maximum 5 to 10 minutes, your mind will go to the next level of decision making. I am telling you, your mind will naturally go to the next level of decision making. And then you will be feeling my case may be a Vata Kapha dominant Jara with the Dhadu Paga or Dhadu Mala Sanjaya as the clinical scenario. You will start with a Lankana, Deebana, Pachana, Chikilsa. Naturally, you will go to a level of medicine because Vata Kapha both are Shida Virya. You have to give something which is Ushna Virya. And whenever there is Shida is there in any system, if Shida Guna operates in the respiratory tract, there will be Stambhana. You should know in your second year, I am telling first year fundamental, second year you are telling whenever there is Shida Guna will lead to Stambhana. Yes, Stambhane Shakti Sa Shida. If Shida Guna is operating in the respiratory tract, it will lead to Srodoroda, Stambhana, spasm, limited movements, and there can be all the Srodoroda related Kasa, Shosa, Pinasa. So you will think about a Ushnavirya drug. Because Vata Kaphas are there, even though there is Jara, you will think about a Ushnavirya drug which will not vitiate Pitta to such a level. So that is why mild Ushnavirya drugs will be there. You will be thinking about a drug which is Amapachana, which will empower the status of Agni, and then you will select a drug which will create Srodo Shuddhi in the Kantha. Kantha is Kapasthanam. Uras is Kapasthanam, Ura Kantha, both are the seats of respiratory issue. Amashya is the seat of Ama, Ura Kantha, Amashayam. All the three are Kapha sites. Are you getting me? Then you will remember your first year teacher. You will remember your first year teacher who taught you Ura Kantha Shiraklomama, Parva Nyamashayo, Rasaha Medo Kranam Tejihwaja, Kapasya Sudaram Ura. My dear students, luckily we do have only 3 doshas. Luckily, we do have only 3 doshas, so you will identify that there is a strong role of the Kantha. There is strong role to the Ura. There is strong role to the Amashya and the Parva joints. So all are Kapasthana. Naturally, you will select a Vata Kapakara drug and you will be starting the treatment with the Amapajana drugs. Then you can think about Amrudottaram Kashayam, Vaishwanada Churnam, Shadharana Churnam, any drug. Drugs are innumerable. The thing is the correct identification of the treatment principle using or strictly adhering to the fundamental. That is what I am telling. Then only you will be becoming a successful clinician by yourself. Otherwise, you can copy all the medicine from any textbook you can write. No. So you identified the status of dosha as Vata Kapha based on the clinical inputs from the patient. Then you identified the status of Agni, identified the status of Koshta. Then you fixed that I am going to prescribe Vata Kapahara Jora Chikilsa. Then naturally your brain will go to Charaka Jora Chikilsa, Ashtangradin Jora Chikilsa in the third professional which you studied. Then naturally you will think about a Pajanamradam Kashayam, Amrudottaram Kashayam, Pathya Kustumbaradi Kashayam. All these medicines are there. And if there is more Kapha, if there is more domination of respiratory features, you will think about Vyakriyadi Kashayam. I still remember when the episodes of H1N1 was reported. We very well know H1N1 share the same clinical features of Vata Kapha Jara, even though the nature is Agandu. H1N1 is a viral related fever and all the viral infections are considered as Agandu Jara. We started giving the Vyakriyadi Kashayam only. When you can add something to empower the respiratory function like Vasharishtam, Kanagasavam, something like that. And if there is excessive respiratory issue with Arojaka, generally in Vata Kapha dominant Jara, there will be Arojaga. You can think about Vyoshadi Vadagam, Pinasa, Shosa, Kasakinam, Ruji Swaragaram Param. So remember, naturally your mind will go to the yoga, and from the yoga you will come to the yoga. So the pharmacology to pathology, pathology to pharmacology, your brain will be having mutual clinical knowledge exchange. Are you following me? From yoga to yoga, yoga to yoga, pathology to pharmacology, pharmacology to pathology, your mind will be having this two-way traffic, and then you will be finalizing the drug. This is the way to think about a patient using classical concepts. I think it is very clear. Same way, if you are getting a patient coming with a high-grade fever, I am telling some basic fever because that will be easy for you to understand. Just like a case of dengue hemorrhagic fever. We are getting very good number of dengue fever cases. And we very well know what is happening in dengue fever. It is a viral related disease. And in the second stage of dengue fever, you are getting the thrombocytopenia, massive reduction in the platelet count. And then you have to think about the Jora and Rektapitta together. Actually, my dear friends, when you studied second BAMS, you studied Charaka Samhita, Nidanastanam, and you studied a concept called Nidanarthakara Rogam. I am always connecting to the textbook only, because otherwise you will feel that what is the need of studying textbook if you know the name of a drug? My ultimate aim is to connect you with the principles, and by which you will feel that every sloga, every concept you studied or you are studying can be applied in the practice. There is a beautiful concept by Charaka, the very exclusive concept, that is the Nidanarthagara Roga. Nidanarthagaro rogo rogasya pyupajayade. What is the meaning? One disease will be leading to another disease. Jwara santapada rekta pitta mudirade. It's a common sentence we come across in Charaka Samhita, especially in the 8th chapter of Nidana Stanam, Avasmara Nidana. And what is the meaning? One disease will lead to another disease. The typical example is Jwara santapada rekta pittam. We very well know Jwara is a pitta dominant disease. And when there is extreme elevation of Ushna Tishna Guna, very important, my dear friends, every cellular damages are caused by Vimshadi Gunas only. That is what I am telling. Whatever you tell in modern medicine, ultimately the clinical impact to any cell, any tissue, any organ, any system is caused by an impact of a Guna. If excessive Ushna Tishna Guna operating in Rekta Dhadu, definitely it will destroy the cells. As a result, you are getting the thrombocytopenia, you are getting bleeding. Jwara to Rekta Pitta. Are you getting me? And when you read again Rekta Pitta Nidana, it is clearly mentioned. All the excessive Ushna Tishna Guna will destroy the clotting component called platelet. I believe if a particular component is helping the process of clotting, coagulation, that should have a kapha domination. Only kapha is Snigdha, Shida, Slashna, Sandra, Mrudu, Sthira. Please follow the fundamentals. I am again taking you to the first BAMS only. The Snigdha, Shida, Guru, Manda, Slashna. So anything which can make a clot, anything which can make a sealing, which can act as a plug, which can stop the bleeding, should have the properties of kapha, and kapha will be easily attacked by Ushna Tishna. Are you getting me? Kapha is Mrudu, kapha is Snigdha, kapha is Guru. So kapha will be easily attacked by Ushna Tishna. That is why excessive elevation of Ushna Tishna in Pitta Jwara will be leading to Rekta Pitta. Jwara Santapad Rekta Pitta Mudirade. It is nothing other than dengue fever to dengue hemorrhagic fever. Then you see the medicine. What can be the medicine? You are getting fever, you are getting Rekta Pitta. So you should have a drug which will work both in Jwara and Rekta Pitta, which should be Shida, Stambhana, Pitta Rekta Shamana. Naturally, your brain will go to Pittadika Sannibada Jwaram and you will identify Drakshadi Kashayam. Naturally, your brain will go to Drakshadi Kashayam, which is absolutely a Shida Virya drug. And if you come through the indication, you can see both Jwaram and Rekta Pittam. Draksha Maduga Maduga Lodra Kashmirya Sharibaha Mustamalaga Kribera Patmakesara Patmagam Mrnala Chandanoshira Nilolpala Parutshagam Pando Himova Drakshadar Jadi Kusuma Vastida Yuktam Madusida Lajer Jayati Anila Pittajam Jwaram Madatayam Chardi Murcha Daham Sramam Pramam Urdagam Rekta Pittam Cha Pipasam Kamala Mapi. So what I am telling, how you are finding a drug, how you are reaching into a drug. This is the road map. This is the way to reach the Samprapti Vigatana by exploring the Samprapti. So what was your responsibility? You examined the patient. You identified it is a Pitta dominant Jwara. You got the laboratory report that there is massive thrombocytopenia, massive bleeding, epistaxis, and purpura, Rekta Pitta, Jwara. Both are Ushna Tishna. Treatment should be opposite. That is Shida Virya in the context of Jwara. When you will be naturally going to a drug which is mentioned in Jwara, mentioned for Pitta, mentioned for Rekta Pitta, mentioned with the Shida Virya drugs, then you will take the pen and write Drakshadi Kashayam. Are you getting me? So this is the way how you are writing Drakshadi Kashayam in a dengue hemorrhagic fever. Say for example, you are getting another type of fever. The third case of fever, the patient is coming with a very, very severe joint pain. And all the clinical features of AMA are there. Angamarda, Aruji, Trishna, Alasyam, Gauravam, Jwara, Apaga, Shunata, Manganam. Shunata means swelling. The patient is presenting with the swelling, especially in the ankle joint, with very serious joint pain and Ama Lashana. Definitely, Vada domination with Ama, you can come to the conclusion that including fevers like chikungunya. We very well know yet another Agandha. All these Jwaras are very common in different parts of India nowadays. So you will be coming to the conclusion that Vada domination is evident from the clinical and pathological picture of chikungunya. So you will select a kashaya which is Vada Shamanam, Amapajanam, then naturally you will go to Rasna Panchakam. What is Rasna Panchakam? Rasna, Guduji, Erandam, Devadaru, Mahaushadam. Only 5 drugs are there. You see the 5 drugs? I am telling individual ingredients of each drug, and then I am telling the combined effect of the yoga. Rasna, Guduji, Erandam, Devadaru, Mahaushadam, Pibel, Sarvangage, Vade, Same, Sandhyasti, Majjage. So, my dear friends, I told only one concept: identify the signs and symptoms, then go to the dosha domination, then go to the same context in the textbook, then go to the related yoga and make it a habit of prescribing the medicine by which you will feel that you are closely connected with the science of Ayurveda. Otherwise, I will be telling some 5 names: chikungunya, Rasna Panchakam, dengue fever, Drakshadi Kashayam, leptospirosis, yet another disease. You very well know leptospirosis. We call it as Wilt's disease. That is a bacterial origin. All the other 3 were belonging to the viral component, but this particular leptospirosis is caused by bacteria. We call it as leptospira icterohemorrhagia. What is happening in the case? Here also it is an agandu jwaram. As soon as the leptospira is entering into the body through the contaminated water by any crack or wound, the patient will be developing first jwara. Again jwara only. But later, in the second stage, the patient will develop kamala. There will be intrahepatic necrosis. Intrahepatic necrosis, Yagurpagam. Yagurpagam will be there and they will develop kamala. Jaundice, serum bilirubin rate will gradually go high. And even they will be getting intranecrosis, intrarenal necrosis. So there are Virkapagam and Yagurpagam. So what can be the answer? In leptospirosis, same way the dosha status started as pitta. As it progresses, it is coming to the stage where again Kamala with the Pitta involvement. Then naturally you will think about a drug which is Jwarahara, Kamalahara. Are you getting me? Jwarahara drug, Kamalahara drug, because in the laboratory report you are getting abnormal liver function test. You are getting all the LFT abnormal. So your brain will go to a disease which is, your brain will go to a drug which is Jwaraharam and Kamalaharam. Then naturally you will think about a Padola Kadirohanyadi. Your brain will go to Ashtangradayam Sutrastanam chapter number 15, where different ganas are mentioned, and you will start thinking about a Padola Kadirohuni Chandanam Madhusrava Guluji Padanidam Nihandi Kapha Pitta Vishamajjuram Visham Vami Marojagam Kamalam. Then you will feel that actually Vagbada mentioned this medicine even before he identified about the leptospira icterohemorrhagia for this purpose only. That is what we are telling in the previous inaugural address. B.S. Prasad sir and Prasanna Rao sir told about the pre-COVID Ayurveda and post-COVID Ayurveda. Nobody thought about a drug for COVID when we studied BAMS. But we know our fundamental principles are so intact and integrated by which any emerging condition can be clinically applied using the Tridosha principle. That is the time-tested beauty of Ayurvedic science. I repeat the word time-tested beauty of the Ayurvedic science. So let us come back to the leptospira, Padola, Kadirohanyadi, you will write. So now I will come to a conclusion. When you studied Jwara in your Nidana or in your Chikilsa, there is a word which is common, Jwaro Rogapati. Jwaro Rogapati, Jwara is the model disease. Why? I will tell you, Jwara plus Rektapitta, dengue hemorrhagic fever. Jwara plus Kamala, leptospirosis. Jwara plus Shosa, H1N1. Jwara plus Amavada, chikungunya. All the 4 are emerging new conditions which we face now, but we can treat using the very time-tested all the fundamental principles of Ayurveda. Are you getting me? So you never open the textbook and wait for a chapter, Adha, the dengue hemorrhagic fever nama adhyayam vyakyasyamaha. There is no chapter. There is no need. Ada the COVID-19 nama adhyayam vyakyasyamaha idikas mahuratre adayo marshe. No need. So what I am telling, study the fundamentals. I discussed about the 4 very commonly available infectious disease, and I told you how to deal them using Ayurvedic fundamental principle with the time-tested yoga from my clinical experience to show you, to convince you that learning fundamental principle is the first step of making of an Ayurvedic clinician. Clear? It doesn't mean that you are studying the fundamental daily. You are reading the textbooks, doing the Samhita Parayana. No, that is the primary thing. So grow beyond that. Grow beyond that. When you feel that there is bone and joints are involved with ama, There can be H1N1 possibility, then go to Vata Kapha Chilsa. There can be Amavada, then go to the Chikungunya spectrum. Accordingly, you can make your own decision. Okay, so that is the first step. Then second thing is, I always try to tell this theory in any of my class. You learn about the Vikalpa Samprapti. You may ask me the question, what is Vikalpa Samprapti? Then your answer will be, I have written Vikalpa Samprapti for 2-mark question in my second BAMS examination. You forget about the marks. Actually, marks are having no importance, except marks will be deciding whether you are passing or failing. Okay, what I am telling, when you are asked to tell what is Vikalpa Samprapti, you are supposed to tell in a clinical language. Your answer should be in a clinical language. I will tell you, you know the case of motor neuron disease. Let us go from Jura to Vada Vyadhi. We very well know motor neuron disease. And motor neuron disease, what is happening? You are getting the degeneration of the motor neurons, by which the muscles will be becoming weak. Their strength will become low, their tone will become low, the muscles will undergo wasting, and finally the patient will be losing the bella, samhanana, everything. The commonest case of motor neuron disease is ALS, amyotrophic lateral sclerosis. It is not directly mentioned in our science, but we very well know something is happening to the neurons, by which the neurons are gradually dying. And then the muscles controlled by those neurons will not be functioning normally. We call it as motor neuron disease. And if you identify the Amsha Kalpana, Amsha Kalpana means Vikalpa Samprapti is telling that Tatra Vikalpo Amsha Doshanam Samavedanam Vikalpo Amsha Kalpana. What is the meaning? I can very easily explain to you. When you consider a case, there will be more than 2 dosha, maybe all the 3 dosha involved. If it is a Samsarga Roga, there can be 2 dosha. If it is a Sannibada Roga, there can be all the 3 dosha. Which particular guna of which dosha in which quantity really led to the disease. This mathematical calculation is called Vikalpa Samprapti. I will explain it very simply. You know how much Rusha guna of Vada resulted in the degeneration. Are you getting me? Rusha guna will be leading to Shoshana. According to Hemadri, Yasya Shoshane Shakti Sarusha. Wherever you are getting the Ruksha guna increase, that particular cell will undergo degeneration. We very well know if the Ruksha guna in the Sandhi is getting reduced, if the Ruksha guna in the Sandhi is getting increased, the joint will undergo degeneration. You may get a disease called osteoarthritis. If Ruksha guna is increasing in the neuron, definitely the neuron will become degenerated. You will be getting motor neuron disease. If Ruksha guna is very much reduced in the skin, your skin will be losing the normal Snigdha guna and your skin will become dry, then scaling, then there can be development of cracks. If Ruksha guna is increasing in your colon, in your intestine, the water component in the colon will become minimum, your costa will become dry, and the patient will develop constipation. If the Ruksha guna in the eye is reduced, there will not be any tear, there will not be any water content, and your eye will become very dry eye. So what I am going to tell, the quantification of individual properties of individual doshas in a combined samprapti is called Vikalpa Samprapti. I think you are understanding. I will tell once again the individual gunas of individual dosha. Say for example, how much Ruksha of Vata in Kadigraha, how much Ushna of Pitta in Pandaroga, how much Snigdha guna of Kapha in fatty liver, how much Manda guna of Kapha in hypothyroidism, how much Shida guna of Vata in Shikapaja Jara, how much Shida plus Ruksha together in a case of Vada Jara. This mathematical quantification is called Vikalpa Samprapti. So my dear friends, next time when you take the case, when you are listening to the patient and when you are going through the signs and symptoms and you are going through the history episodes, you identify that this is the proportion of involved dosha in any case. I will tell you generally when Vata Pitta works together. Luckily, we do have 3 dosha. That is very, very good for Ayurvedic graduates. Only 3 doshas are there. In English alphabet, 26 letters are there. Only 3 dosha. And if there is a Vata Pitta combination, What is happening? Vata is generally Ruksha, Pitta is generally Ushna. The combination of Ruksha plus Ushna will together make the cell dry, no doubts. Rukshana of the Vayu, Ushna of the Pitta together operates in a cell. That cell will become dry and the cell will lose the water component, cytoplasm, and it will become dehydrated. That will become dehydrated. Something which is dehydrated, what is the solution? If the Samprapti is dehydration, what is the Samprapti Vigattanam? Rehydration. That is why in Vata Pitta conditions of Shosha, we are adding Snigdha Guna as Snehapana. When you are asking what is the general indication of giving Girda to any patient, generally nowadays people due to the cholesterol fear, they will never write any Girda. But I very well know so many cases with the degeneration, the ultimate treatment is Girdapana only because Vata Pittotare Girda. Science very beautifully told. If you go to the Jwara Chikitsa by Charagam and Vagbada, I am really telling you how to connect with the textbooks for your daily practice. Kashaya Pana Pathyana Dashaha Idi Lankide Sarpur Dadyat Kape Mande Vata Pittotare Jore. When there is Vata Pitta increase in a cell, listen carefully, those who are not having this idea before, in a particular cell, Kapha component is coming down and the cell is becoming Vata Pitta dominant, then the only answer is Girda. You just go to the Vidaryadi Girdam. There is a yoga called Vidaryadi Ganam. And if you see the indication of Vidaryadi Ganam, it is beautifully told Vidaryadi Rayam Hridyo Brahmano Vata Pittaha Shosha Gulma Anga Marda Urda Shosa Kasa Harogana. Vidaryadi is a yoga which is Vata Pittahara, so which will be Brahmana, which will be Shosha Hara. If there is a dry cough, I am repeating, if there is a dry cough, an allergic cough, an irritant cough with definite evidence of Kavatshayam, prescribe Vidaryadi Girdam. Never prescribe Vidaryadi Girdam in a productive, kapha dominant, congestive type of cough. Are you getting me? So dosha domination is very much important. That is why when you get a case of motor neuron disease, you identify that there is Shoshana. Shoshana is due to the degeneration, and then you have to regenerate, and regeneration can be done only by Vata Pitta Hara and Kapha Kara Chikitsa. Vata Pitta Haram and Kapha Kara Chikitsa, then you will think about a Brahmana yoga called Vidaryadi Girdam. But again, problems comes. Before administering any Brahmana Chikitsa, you have to make the concerned system very much ready to absorb the medicine. A great mistake done by Ayurvedic common Vaidyas, they will straight away jump into the Brahmana Chikitsa. I very well know my case is a degenerative disease like a motor neuron disease. Degeneration means Dhadushayam, Rasakshayam, Shosham. So the treatment is Brahmana, and naturally I will jump into a Rasayana. Don't do it. You have to do Brahmhyastu Mridhu Lankayel. Before starting the medicines of any Brahmana, do the Sarodo Shuddhi. What do you mean by Sarodo Shuddhi? The available medicinal component should reach the targets. The bioavailability of a medicine should be fixed and determined. That is what is called Sarodo Shuddhi in pharmacology. Sarodo Shuddhi in pharmacology means the concerned molecules of a drug should reach the target. And to make that easy going, you have to create a Lankhana. That is why Brahmhyastu Mridu Lankayel. So what is the purpose? You have to do some Lankhana Chikitsa, some Sarodo Shuddhikara Chikitsa before going to the Snigdha Chikitsa like Brahmana. So what you will do? You can give a Vaishwanara Churnam 15 gram with hot water or Takram 3 to 5 days. Then only go to the main Brahmana medicine. Are you getting me? Just like you are, if you want to paint your wall with the very latest emulsion paint, what you will do? You will straight away never do the painting. You will remove every unwanted dirty things by sandpaper, and then you will clean the wall. Then only you will apply the fresh paint. Like that only. So in every Dhadushaya case, I am repeating every Dhadushaya case of degeneration, like motor neuron disease, like Parkinson's, like any other cases of brain degeneration, do some Lankhana Sarodo Shuddhikara Chikitsa by a Churna, preferably Vaishwanara Churna, Shadharana Churna, then only go to the main Brahmana type of Rasayana. The concept is very simple. Brahmhyastu Mridu Lankayel. Okay. Now you have to do Shodhanadi Chikitsa. Kevala Shamana Chikitsa may not be useful in every disease. We very well know the difference between Shodhanam and Shamanam. There is a beautiful classical reference which all of you have to keep in your brain. Tatra alpe langanam pathyam, madhye langana pajanam, prapude Shodhanam tabhi, mula dunmulayen malan. What is the meaning? You think a case where you are getting gradual accumulation of Medo Dushti in your body. Gradual Medo Dushti by LDL. The Vigrada Medas like LDL is gradually getting built up in your body. Serum uric acid is gradually building in your body. And serum uric acid accumulation of the LDL, etc. are leading to multiple organ damage. And you cannot simply control by a normal Shamana Jagilsa. So do Shodhana. Dosha kadajit kupyandi jidha lengana pajanai. Edu samshodhane shuddha na tesham punarudbhava. What is the meaning? Whatever disease you treated with the minimum Shamana Chikitsa, there can be a chance of recurrence. But the diseases which are treated by Shodhana Chikitsa, the chances of recurrence will be comparatively low. This is very well evident in psoriasis. We are treating that much number of psoriatic cases here, especially in dry weather and in conditions like dry weather conditions and in cold conditions of December or January, especially in India, it will increase. And what is the reason? It is a notorious autoimmune disease which will be relapsing and having the remission. So do Shodhana. In my clinical experience, I will identify the dosha domination of psoriasis. Generally, my dear friends, plaque psoriasis belong to Vata Kapha. Generally. But if you are getting a palmoplantar psoriasis or you are getting a pustular psoriasis where the pustules are there in palm and sole, where there is swinging pyrexia, then there can be pitta nubandha. Otherwise, generally, psoriasis is Vata Kapha. So do Snehapana preferably with Tiktaka Gردam, Aragudha Mahatikta Gردam, Padola the Gردam, etc. And then go to the Svedana, then do Vamana Virejana, then only go to the Shamana Chikitsa. Because the doshas which are Tiryagada, these are the clinical words. We learn all the modern clinical words, but we least bother about our clinical words. This word is very important, my dear friends. The word is Tiryagadi. You know what is Gadi in our body. Doshas will be moving upward, downward like that. What do you mean by Tiryagadi? Tiryagadi is the abnormal movement of dosha which are very, very, very far away from the Shodhana Margam. Shodhana Margam Parityajya. They are away from the main roots of Shodhana. So they are very much connected with very much deeply seated in the dhatu. So they cannot be easily separated. Such status is called Tiryagadi, a notorious clinical stage which is evident in psoriasis. That is why we have to do repeated Snehana Shodhana in treating chronic skin diseases, especially chronic autoimmune skin diseases. So do Shodhana Chikitsa as a mandatory practice whenever you feel that the disease is chronic and you are getting the disease very chronic. So Snehapana is mandatory. Sometimes you are not able to do Shodhana due to the weakness of the patient. All the patients may not be eligible to undergo Shodhana. Then you can do Alpa Shodhana. That is why Manibhadra Gulam is mentioned. My dear, considering all the problems faced by the normal physician, Acharya provided multiple options. I am telling you, if you are not able to do a very powerful Shodhana in the patient due to the Belahani, due to the age, due to other complication, you can do Alpa Mala Shodhana. That is a drug called Manibhadra Gulam is mentioned in Kushta Chikitsa. So that can be given 15 to 20 gram of Manibhadra Gula given at a time. Will be causing a Murdu Shodhana without leading to much dhadu kshopa. Generally, the problem of Shodhana is if you do an untimely Shodhana, if you are doing a Shodhana in a contraindicated case, which will be disturbing the normal symphony of dhadus. I know, I understand what is the meaning of symphony destruction. When the symphony dhadu samyada, dhadu sarada will be destroyed by abnormal Shodhana, then you can induce a controlled Shodhana. For that also there are medicines are there. Actually, what I am telling, Acharya very well know the clinical dilemmas which you are going to face, for which he has placed so many answers. So identify the entire science as a whole, then you can select this particular treatment principle is for this patient. For another patient with the same disease, with the different status, treatment is different. In the previous speech, somebody told about Dushyam, Desham, Velam, Kalam, Analam, Pragradim, Vaya, Sattam, Satmyam, Tadaharam, Avastasya, Pradakvidha, Sukshma, Sushma, Samishesha, Doshavashada Nirupane, Yo Vartade Chigilsayam, Nasaskalati Jadujit. And what I am telling in the next level, you identify whatever be the pathology in modern medicine. Some pathologies may be autoimmune, some pathologies may be metabolic, some pathologies may be degenerative, some pathologies may be neoplastic. These are the general common pathology. Samanya Samprapti. Autoimmune diseases we are getting just like rheumatoid arthritis. You are getting Hashimoto thyroiditis. You are getting systemic lupus erythematosus. These are the autoimmune diseases. We have a particular strategy. When there is autoimmune disease, the basic thing is to correct the Agni. Why you have to correct the Agni? Because we very well know Agni Moolam Belam Pumsam. Agni is Belam. The same Agni can turn against the body and destroy the normal, friendly, healthy Dhatu. Then we will call it as autoimmune disease. I would like to take you to the last sloka of Grihani Chikilsa. You may ask me, sir, what is the connection between Grihani and autoimmune disease? Every disease in Ayurveda are connected in one way or other. Ahara Magni Pachadi Doshan Ahara Varjide Dadun Shineshu Dosheshu Jividam Dadu Samshaye. What is the meaning? A very intelligent sloga by Vagbhata Charaka. Both Acharyas shared the same sloga. Ahara Magni Pachadi. Normally the food is digested by the Agni. In the absence of Ahara, the Ama will be digested by Agni. That is treatment. Ama will be digested by Agni. And even in the absence of Ama, the Agni will destroy the Dhatu. The normal Agni, which was protecting the body as Belam, will turn against the normal Dhatu, and Dhatus will be destroyed by the Agni. We call it as Dhadugada Atyagni. Dhadugada Tishnagni, that will be leading to tissue destruction, and the pathology will be very much similar to autoimmune disease. The same Dhadu Paga is occurring in SLE. You think about SLE, systemic lupus erythematosus, a disease which is never directly mentioned in Ayurveda. But if you can explore the Ayurvedic fundamentals with a beautiful clinical correlation, you can see multiple level Dhadu Pagas are seen in SLE. I repeat the word, multiple level Dhadu Pagas are seen in SLE. You are getting arthritis, you are getting hepatitis, you are getting nephritis, you are getting dermatitis, you are getting vasculitis. All the inflammations in different dhadus and srodasas are there in SLE. So, multiple dhadu paga chikilsa is important. That is why when I am treating the SLE, I will be combining Pittadiga Sannipada Jwara Chikilsa. I am combining the treatment from Pittadiga Pandu Chikilsa, Pittadiga Kushta Chikilsa, and even Pittadiga joint pathology. So all these things can be combined. Dadimadi Gridam can be given. Mahadiktaka Gridam can be given in SLE. But remember, Gridabana can be started only after empowering the Agni. In all Dhadu Paga conditions, I am giving you a vital clinical tip. In all Dhadu Paga conditions where autoimmune related inflammations and necrosis will follow, you have to do Gridapana. Dhadu Paga answer is Gridam only. But how you can give a Grida Kalpana? You cannot give a Grida straight away because that may aggravate the existing Agni-mandya. So do Ama Pajana, then make Srodo Shuddhi, then go to the Gridapana by Pitta Shamana drug. Dadimadi Gridam is excellent in Pandu. Dadimadi Gridam is mentioned in Pandu Chikilsa, and you very well know, if you know the pathology of pathogenesis of SLE, you are getting anemia, you are getting leukemia, and you are getting the thrombocytopenia. All the three cells are coming down. Red cells will come down, WBC will come down, platelet will come down, and then you can think about Pandovamayi, Pibedado, Sarpur Kalyanagahoyam, Panchagavyam Mahasiktam, like that, and Dadimadi Gridam is selected. Same way you can think about the Mahatiktaka Gridam. Mahadiktaka Gridam is indicated in Kushta Chikilsa. We very well know Kushta Chikilsa is very much connected with the Rekta Dushti. And the Rekta Dushti is a common phenomenon in SLE. You are getting dermatitis, mala red, the butterfly rash. You are getting vasculitis, you are getting hepatitis, you are getting nephritis, you are getting meningitis. So everywhere you are getting Dhadu Bhagam. So my point is very simple. If you study the modern pathology of SLE and if you understand what is happening in Dhatu Bhagam and you understand the Grihani concept of Dhadugada Atyagni, then naturally medicines will flow. You cannot search the chapter textbook that whether there is a chapter called SLE. No. You will be getting multiple chapters of Ayurveda, but your clinical intelligence using your Dhi, Dhridi, Smriti. In your first year, your teacher might have taught you about Dhi, Dhridi, Smriti. I am repeating you, Dhi is clinical intelligence. Dhridi means clinical execution and Smriti means clinical retention. So you study something using the Shastra, you implement something in the patient, then that implementation result will be in your brain as Smriti. So Dhi to Dhridi to Smriti, again to Dhi, this is the way you are becoming a clinician. Are you getting me? This is the way you are becoming a clinician. The Dhi from your first year, Dhi from your second year, applied in the Dhridi in the third year in a patient and getting the Smriti of it Upashya or Anupashya, which will be back supporting your Dhi. This is the way to grow from the science to the real practice. That is what I am telling. Making of an Ayurvedic clinician is strictly based on the knowledge on fundamental clinical principle. Okay. Now, one more important thing I will tell you. That is regarding the Vyadhi Avastha. That is regarding the Vyadhi Avastha, clinical stage. My dear friends, even though Ayurveda tells treatment for every disease treatment is limited to a stage only. That is very important. Ayurveda will tell you apply Lebana in a Sandhi where there is arthritis. Ayurveda will tell you apply Lebana in a Sandhi where there is swelling or arthritis. But that is limited to only in the superficial acute stage of arthritis. When you are going to get the destruction of the cartilages of the bone and you are going to develop the bone deformity, Lebana will not do much. Then you can think about the deeper treatments. I would like to invite you to the disease called Vadarektam. I would like to invite you to the disease called Vadarektam, where you are getting dermal, vascular, and arthritic pathology together. My dear friends, never underestimate Vadarektam. Some people will tell that Vadarekta is gout arthritis. Some people will tell that Vadarekta is rheumatoid arthritis. But you really clinically evaluate the disease, you can see Vadarekta is a dermal pathology, Vadarekta is a vascular pathology, and Vadarekta can be a joint pathology. And there beautifully Ajayara is telling the treatments in two domains, Uttanam, Gambhiram. What is the purpose of dividing the disease into two stages? Next 5 minutes, I will be talking only about the clinical phases. Vyadhi Avastha, Tvangmam Sastriyam Uttanam Tat Purvam Jayade Tada. What is the meaning? Certain diseases will be limited to superficial dhatu. We call them Uttana, where Behi Parimarjana Chikilsa alone is enough. You need not go to systemic Snekhabana. There is no need of systemic Snekhabana, Vasti, Viredana, Rasayana. Only Uttanam, Lebana, Abhyanga, Parisheka, Avagaham. When you are getting only superficial swelling with the discoloration and pain, you treat with the Lebana, Abhyanga, etc. And when Lebana, Abhyanga both are there, which you will administer first? Lebana is Langhana. Lebana is the application of Langhana, Legaguna in Sandhi. Legaguna in Koshta is Upavasam. Legaguna in Sandhi is Lebanam. Are you following me? How you are clinically applying Legaguna? Legaguna is for Langhana. Langhana in Sandhi is called Lebana. So do Lebana first. You are expecting the reduction of the swelling. And once you get the reduction of the swelling, identify that there is less kapha, less Snigdha guna, more Ruksha guna, then go to the Abhyanga. So my point is very simple. Imagine, my dear friends, you are getting a painful joint with the swelling. Imagine, I think still you are sitting in the old consulting room only. I told you to imagine that you are sitting in the consulting room. I think still you are there, but a different patient is sitting in front of you. A patient is sitting with the pain and swelling in the joint. ESR is high. You very well know it is a case of rheumatoid arthritis, maybe pain and swelling. So we very well know pain is due to generally Vada and swelling is generally due to Kapha. And which you will treat when there is Kapha and Vada together, you will treat first Kapha only because Kapha is Guru, Snigdha, Shita. Only after treating the Guru Guna, Snigdha Guna Dosha, you can go to the Vada because Vadasya Upakrama Sneha. Remember, sharpen your brain. Vadasya Upakrama Sneha, the ultimate treatment for Vada in any system is Snehana and Brahmana only. How you can do snehana without treating the kapha? In the joint there is swelling. When there is swelling kapha, so bring down the kapha by lepana chikilsa, nagarada leba, grahadoma leba, something like that. Then when kapha comes down, when swelling comes down, identify that the joint is vada dominant, vada syobakrama sneha, you can go for abhyanga. Are you getting me? Yes or no? I want your answers. I think I am talking like a radio only. I think you are listening. So in a patient where there is both swelling and pain, swelling is generally due to kapha, pain is generally due to vada. So first treat kapha because swelling is due to kapha. Without treating kapha, you cannot add any snehana to the vada. So treating kapha is mandatory first. How to treat? You will apply lebana, nagarada leba, grahadumada leba by ruksha guna. Churnas like lebana will bring down the snigdha guna. Synovial fluid, if it is excessive, will come down. Then swelling will come down. Pain will be remaining. And when swelling comes down, still pain is there. You will guess that kapha less, more vata, kevala vadam, no kapham vadasya upakrama sneha abhyanga. Are you getting me? So I think now you feel that treating Ayurveda needs that much element of mathematical calculation of Vimshadi Guna. That is why Shadobakrama Ayurveda told Guru to Brahmana, Legu to Lengana, Ushna to Sedana, Sida to Stambana, and Ruksha to Uddhartana, and Snigdha to Snehana. That is why Shadobakramas are there. Okay, so my point is identify the Vyadi Avastha. One more thing I will tell you. When you are getting a case of Adhisara, so we started from the Costa, we went to the Jora, we went to the neurology, motor neuron disease, we went to the SLA, autoimmune disease, and now we are coming to a case where you are getting diarrhea, GIT. There are so many conditions of abnormal GIT conditions mentioned in Ayurveda. There are two groups of disease, inflammatory bowel diseases. I think you might have seen about inflammatory bowel disease and irritable bowel syndrome. Two groups of diseases which are generally affecting the colon. In inflammatory bowel disease, generally Pitta Rakta Anubandham will be there. IBD, inflammatory bowel disease, we are very much connected with Pitta Raktaja, Adisaram, Pitta Rakta related Pravahiga or Pittaja Grahani. Pitta will be there, and bloody mucoid diarrhea will be there. The internal colonic mucosa will be eroded, by which the absorption of the essential nutrients will be affected. So patient will become lean, bloody mucoid diarrhea, anemia, etc. Everything will be there. So what you will do? You will do first Pitta Raktakara Chikilsa, you will stop the bleeding, and then you will empower the Agni, and then naturally you will prescribe a medicine which will be healing the internal colonic mucosal lining. I am telling you, Pittasya Sarpisha Panam Sodhisidir Virejanam. You studied in fundamental. And Pittasya Virejanam, you very well know you cannot do Virejana when there is an inflammatory bowel disease, because inducing a Virejana will aggravate the bleeding. What you will do? You will empower the Agni status in the Kosta, and you will be prescribing Dadimashtaka Churnam, Kapittashtaka Churnam, which are mentioned in Adhisara. So you will be controlling the Adhisara. And when you feel that there is very good appetite, Agnim Jarana Shaktya, when there is very good appetite, naturally you will go to Gridapana, which will heal the intestinal mucosa. There are so many medicines mentioned in Ayurveda, Charngeri Gridam, Dadimadi Gridam, etc. are the medicine which will be healing the internal mucosa of the colon. But these gridas can be given only after empowering the Agni by Dadimastaka or Hinguvajadi or any other drug, depending upon the condition. And then you have to stop the bleeding. You have to stop the bleeding. You have to arrest the bleeding, because bleeding itself is a dangerous situation in chronic inflammatory bowel disease. Think about the Pichavasti. Vada Sleshma Vibandeva Kafe Vadi Sravatyavi Tule Pravahigayamcha Pichavasti process. The Shalmali Pushpas are taken using the Ajatshiram. What about Ajatshiram and bloody mucoid diarrhea? You go to Sutrasanam again. Alpambupana Vyayama Kadutikta Senir Leku Ajam Shosha Juras Shosa Rekta Pitta Adisarajit. In Rekta Pittam Adisaram, the specific milk mentioned in the Sutrasana itself is Ajatshiram. So you can internally give Ajatshiram with Musta. It is clearly indicate that you can give Gridapana and Shirapana to stop the bleeding. Musta Siddham Paya, Shadavari. In my practice, I always recommend Shadavari Kshiram and Shadavari prepared Grida to arrest the chronic bleeding of IBD. Rektam Purvam va Paschatyo Adisaride, Shadavari Gridam Dasya Lehartam Uvakalped, Ashtangradayam Adisara Chikilsa. Very typically, they are telling Ashtangradaya never told about ulcerative colitis. Ashtangradaya never told about the Crohn's disease, but they told a thing. Vada Sleshma Bande Vashu Kape Vadi Srabatyabi, Sarekta Picha Trishna, all these conditions of Sarekta Picha Trishna, bloody mucoid diarrhea. So I am telling you, my dear students, read the sentences, read the sloga. I always tell to my students inside the class and outside the class, read the sloga, read in between the lines, read beyond the lines, and finally be the lines. I think the same advice I am sharing with you. Read the lines, read in between the lines, read beyond the lines, and then you be the lines, you be the apta. We always follow apta. But when you read and understand the concept, you are becoming apta. Otherwise, no, there will not be any more aptas available because Charaga, Susruda, Vagbada are not now. It is your responsibility to be the apta for the coming generation, for which you have to do the habit of reading the lines, beyond the lines, and in between the lines. Then you will see that Sarekta Picha Trishnartham mentioned in Adisara Chikilsa is very much clinically suitable to IBD. Then naturally you will go to the treatments like Chidabanam, Ajat Chidabanam, Sadavari Gradabanam, and Pichavasti in mucoid damage, more mucoid diarrhea in ulcerative colitis. When you go to IBS, irritable bowel syndrome, what is happening? In irritable bowel syndrome, you are getting the alternate episodes of diarrhea and constipation. There is no visible anatomical, biological, or biochemical neoplastic inflammatory change in colonoscopy. Nothing. You do the colonoscopic examination in IBD, you cannot see anything. No histological damage, no neoplasm, no inflammation, nothing. But the patient will be telling, sir, I am getting diarrhea immediately after having my morning breakfast. So that is what is called a spastic colon. Spastic colon is nothing other than the Pakvashegata Vadam, because according to Ayurveda, colon, Pakvashayam, Purishavahanam Srodasam, Pakvashyo Mulam, Stula Gudascha, and when you read Pakvashevada, when you read Pakvashevada, Pakvashye Krudda Shulana Handra Gudanam Malaroda Ashma Vardharsha Trika Prishta Kadigraha Malaroda there. Then you may ask me, sir, if Pakvashevada is there, there can be only one possibility called constipation. How there is diarrhea? Then I am telling you, Vada is Chala, Vada is Shita, Vada is Ruksha. Ruksha Janida, Shida Janida Vada will lead to constipation, and abnormal Chalaguna, the abnormal motility will be leading to diarrhea. The same Vada with the two different property behave in different way in same Adhisthana. Are you getting what I am telling? Are you getting what I am telling? The same dosha with the two different property in the same Adhishthanam, same colon is operating, and you are getting IBSC, IBSD. Ruksha Guna Vada will cause Shoshana, constipation. Shida Guna Vada will cause Stambhana, spasm, colonic motility reduction, and again constipation. But when there is abnormal Chalaguna of the Vada, intestinal motility increased diarrhea. So same Vada with the different Guna. Now I identified how to identify the Gunas of individual dosha. It is happening everywhere. Same way when Kapha in the Mutravaha Srodhas, you may get an Ashmari. Kapha with Stira Guna, Manda Guna in Mutravaha Srodhas, you may get an Ashmari, like calcium phosphate stone. When you are getting Pitta in the Mutravaha Srodhas, you may get a burning, mixturation, Daha, Raga, and you may get even hematuria, you may get a fever, you may be getting a urinary tract infection. If Vada is operating in the Mutravaha Srodhas, you are getting stricture urethra, you are getting abnormal Mutra Krichrada. So Vatika Krichram, Paitika UTI, Kapaja Ashmari, the same Adhisthana, different dosha, different guna, different pathology, different diagnosis, different treatments. This is what I told. Understand the impact of individual gunas of individual dosha. That is what is called Vikalpa Samprapti. See, when your teacher taught Vikalpa Samprapti in second year, it was a question for 2 marks. Over. But now you identify every case with all advanced modern investigation, all histopathological evidences, all the so-called imaginary methods, all imageology, you can identify which guna of which dosha is responsible for such a particular clinical evidence. So that is what I am telling. Identification of the guna behind a particular pathology is called Vikalpa Samprapti. Very, very much important. Okay. Then I was talking about the different clinical phases. Different clinical phases of the same disease. I told you a phase with amam, a phase with miramam. Say for, let us take an example of a respiratory case. You know, when the kapham, the normal kapha in the respiratory tract or urus is there, it is immunity. Pragradastu belam sleshma. Until and unless my kapha with the normal snigdha siddhadi gunas are there in my kandham, my urus, my amashayam, that will serve as an immunity to me. But when the normal kapha is converted into vigirda kapha, sama kapha, then that kapha will be nurturing the microorganisms, then it will be leading to chest infection. I am telling a vital clinical point. Normal kapha is immunity in chest. Vigirda kapha will be leading to multiple infection. What is Vigirda Sama kapha as per the reference? How you will identify the kapha in the chest is Samam. Agni Mandya can be identified by asking a question, what about the appetite? What about the identification of kapha which is Sama? Abilas Tandulas Tyana Kanta Deshi Avadishtade. Samo Valasa Durganda Shududgara Vibandakrat. When the kapha situated in the chest, in the kanda is avila, sticky, upalebada, and it is causing obstruction. It is leading to dyspnea. It is leading to bronchospasm, bronchial congestion, alveolar congestion, and it is leading to consolidation in the chest X-ray. You identify it is Sama kapha. Ama itself is Guru, kapha is also Guru. When Guru Guna kapha is aggravated by Guru Guna Ama, the Srodoroda will be more powerful. You need extra Shodhana. That is why, my dear friends, Urdha Shodhanam, Adho Shodhanam are equally recommended in respiratory disease. When Acharya is telling about Kapaja Chikilsa or Shotha Chikilsa, Urdha Shodhanam, Vamanam, Adho Shodhanam, Virejanam, both are indicated because Ama converting the normal kapha into Sama kapha will be that much obstructive. Vibandakrit, Shududgara Vibandakrit. Kapha will convert normal Ruji to Arojaka and normal kapha to Sama kapha. That is why wherever there is kapha dosha vitiation, Arojaka will be mandatory. A very important clinical observation. Wherever there is kapha dosha, there will be always Arojaka mandatory. That is why Talisa Patradi Churnam is mentioned for Arojaka Chikilsa in Rajeshma. Tadrujyam. Tadrujyam. So my point is very simple. Identification of the avastha is important. So I am concluding, so many things are there. My the only point which I want to stress is, if you want to be a successful Ayurvedic clinician, start from fundamental principles, identify the properties of individual tridosha, and identify which guna of the which dosha resulted in a disease. That is what is called Vikalpa Samprapti. Then go to all modern clinical evaluation. What is happening to a cell? What is happening to a cell? What is happening to RBC by Tishna guna? What is happening to WBC by Tishna guna? What is happening to the platelet by Tishna guna? Impact of different gunas in different cells, tissue, organ, system, channel. That is the Ayurvedic pathology. Are you understanding me? So what I am telling, the cellular level of Amshamsa Kalpana by Vimshati Guna, that itself will make you confidently, that will itself will give you a confident idea regarding the pathology. Then go to the Vyadhi Avastha. Whether the Vyadhi Avastha is Sama, Nirama, Uttana, Gambhira, Srodoroda, Srodoshuddhi, Jirnam or Uttanam, or Dadushayam or Avaranam. Dadushayam Avaranam is very important in brain conditions. If something is happening inside a cell, that is Avaranam. Beta amyloid protein, Lewy bodies, unwanted metabolic waste are accumulated in a cell in the neuron, that is Avaranam. Avarana will lead to Dhadushayam. Do Lankana Chikilsa, Avatarpana Chikilsa in Avaranam. Do Brahmana Chikilsa, Rasayana Chikilsa in Dhadushayam. In any neurological case, definitely most of them will start as Savarana. In due course of time, they will be converted into Dhatushraya. Charaga beautifully told the fate of Avarana. Avarana will be leading to Dhatushraya. So my point is very simple. The clinical knowledge about a Vyadhi Avastha is very much important. Okay, and the next thing is you do every modern evaluation in terms of the physical clinical examination. Clinical examination is very much important. Laboratory investigations are very much important. They will be adding your knowledge in terms of Ayurveda with the Tridosha. When you know the serum uric acid level is abnormally high, more than 10 milligram, then you can have a doubt that the same uric acid crystal will go to kidney, leading to uric acid stone. Otherwise, you will think that it will be leading only gout arthritis. The patient is telling that I am having pain in the big toe, in the feet, big toe, the thumb, the big toe, there is pain and acute tenderness. That is gout arthritis. You check the uric acid, it is 10 milligram. The patient is regularly consuming viruddhaharam, vidakyaharam, etc., like red meat, alcohol, etc. Definitely, the serum uric acid, the crystals will go to the kidney where they will be deposited, leading to uric acid stones. So the knowledge and the clinical estimation of uric acid is important. When you come to know that uric acid is an unwanted metabolic dhatu malam, with its pitta dominant is increased in the body, which will go to the Mutravaha Srotas, there can be a pitta jasmari, then think about the Shadavari, Gotrida, and give it to the patient. Otherwise, how you will give a Shadavari and Gotrida? Shadavari and Gotrida will be on your right and left, but if you don't know serum uric acid is high and you don't have the idea that serum uric acid will be crystallized in the kidney, you will never prescribe. So knowing the disease is very important. That is why every modern knowledge is important. I always tell my students to be the good CBI officers. You may ask me, what is the connection of CBI and Ayurveda? Generally, we tell that Darshana Parisha, Sparsana Parisha, Prashna Parisha. CBI people are very, very expert in asking questions. With the minimum questions, they will get the best answers. So they are very, very expert in questioning. So CBI means, in my word, CBI means it is not Central Bureau of Investigation. It is clinically balanced intelligence. So I am telling you, CBI means, my final conclusion, be CBI people, clinically balanced intelligence. Your right side with Ayurvedic fundamentals, your left side with the modern knowledge, and your Dhi, Dhriti, Smriti will be switching over from right to left to right, and your decision will be the ultimate thing, which will be reflecting the real pathology samprapti of the patient. And finally, go to the treatment principle. Last 5 minutes. Treatment principles are the principles which you derive based on your clinical observation against a dosha and against a vyadhi. My dear students, treatments are two. Dosha pratiniga chikilsa, vyadhi pratiniga chikilsa. Treatment against a specific dosha like vadasya sneha, pittasya gridabana, kapasya langana. That is general, dosha pratinigam. But there is vyadhi specific, vyadhi pratinigam against a particular disease, a particular chikilsa, then apply both. Say for example, you are getting a case of tamaga shosa, bronchial asthma. Kaphagara chikilsa is mandatory because kapha is causing the block. So you need a kapagaram, dosha pratinigam. You will write Ela Ganadi Kashayam. You will write Dashamula Gadatare Kashayam. You will write Dasha Nayobadi Kashayam. You will write Vyakriyadi Kashayam. That is dosha pratinigam against kapha, because kapasthanam is uras. Kapasthanam is the respiratory tract, and kapha is causing srodoroda. You need a kapagara chikilsam. But there are certain medicines and treatment which are against the shosa as a disease. That is called Vyadhi Pratinigam Chikilsa. You will do Vamana Karma in bronchial asthma, Vyadhi Pratinigam, Dosha Pratinigam. You will be prescribing Dashamula Rasayanam against the Shosam. You will be prescribing Agastya Rasayanam against the Shosam. So my point is very simple. Once you identified the dosha, go to Dosha Pratinika Chikilsa and Vyadhi Pratinika Chikilsa. Definitely, Pathya Karmas are very important. Aharam, Acharam, Viharam, Vikaram. All the four things are having equal importance. That is why Ayurveda beautifully told Nityam Hidahara Vihara Sevi Samikshagari Vishesho Saktaka Dada Samasatya Varakshamavan Aptova Sevija Bhavatya. So you don't simply imitate the Apta, you be the Apta. Those who are studying BAMS in 2025 should be the Apta for students who have to study Ayurveda in 2050. So your responsibility is high. So this is the way to become a successful clinician. So many things I can talk even 5 days continuously about this, but I have just given an outline only because 5 o'clock is already there. I don't want to disturb you anymore. My humble request is identify the dosha, identify the vyadhi avastha, identify the vikalpa samprapti, go to the management principle, dosha pratyaniga, vyadhi pratyaniga, and finally selection of the ahara, vihara, achara, and vigara, pathya. This is the way, but never stay away from the modern contemporary knowledge. That is my request. Anything which will be empowering your knowledge on Tridosha can be taken for your science. If an X-ray will help you to identify the Astisara, take it. If estimation of T3, T4 will be helping to assess the thyroid function, you can take it. Because Dhadugada Mandagini is hypothyroidism. Dhadugada Tishnagini is hyperthyroidism. If Atyagini, Grudabhanam. If there is Mandagini, Langanam. How you will know? Go to T3, T4 and TSH. So any available data which will be empowering your clinical consciousness and such things can be taken, then you need not worry about a disease. The fundamental principle will guide you. The fundamental principle will come to you and it will catch your hand. Come with me, my dear Vaidya. I will take you to the world of medicine. Medicines are enormous. Medicines are available. The connecting link is the fundamental. So read the fundamental principles again. You will be getting new consciousness. So my concluding word to you, from Ayurvedic knowledge, you transform into Ayurvedic consciousness. Both are different. Ayurveda Vidya to Ayurveda Bodha. That is what we need. Vidya means Vada Ruksha. Bodha means Ruksha can be multiple level impact in multiple system. Ruksha is dehydration, Dosha is demyelination, Ruksha is degeneration. This is Bodha. Ruksha is Shoshanam is knowledge. From the knowledge to the Bodha. Ayurvedic knowledge to Ayurvedic consciousness is my humble request. And you know, we all are studying BAMS. What do you mean by BAMS? Bachelor of Ayurvedic Medicine and Surgery. But I am telling in a different way, be Ayurveda in mind and soul. BAMS. Be Ayurveda in mind and soul. Definitely all the modern knowledge will be coming to you. If you never accept this principle, there will be Srodho Rodha in your mind by which modern will not come to you or Ayurveda will not go to modern. So make Vata Nilomada in between Ayurveda and modern. So identify BAMS, be Ayurveda in mind and soul. And finally, one more thing I have to tell. Make a habit of reading one chapter of any Samhita a day, and next day morning, whichever patient you see, try to connect a link between the sloka you studied and the patient sitting in front of you. Now I am requesting you, the patient who is sitting in front of you. I told you to imagine about a patient in my first sentence. That patient is still in front of you. Apply every principle. My last line, for every sloka in the textbook, there are 100 patients. For every sloka in the textbook, there are 100 patients. For every patient in the ward, there are 100 slokas in the textbook. So reduce the gap between principle and practice. And that is what I am telling. Word to word. Word is Shabdam. Word is Pramanam. Word is Shastram. What is the place where you are going to treat? W-O-R-D word, W-A-R-D word, O to A. O means opportunity, A means action. Word to word, O to A. Opportunity of a sloga to an action in the patient. That is the entire story of Ayurveda. I am very much thankful to the organizers for giving me such an opportunity to talk in your 25th episode. I pray to the Lord Dhanvantari and Goddess Saraswati that this Prabodhini should continue and reaching more and more episodes, by which there will be very good Sandarpana Chikilsa to the Jnana related people. If anybody is having Jnana Gada Agni Mandya, this Vidya will become Prabodhini, will become the real Sandarpanam, real Gridabhanam, real Rasayanam. So I am thankful to all of you, the principal, faculty members, and everybody, and especially Dr. Srinas, who was continuously following me without leaving me right and left. He was behind me. So special thanks to Srinas and all the some very dear students who have attended. And final left ventricular request, learn Ayurveda, love Ayurveda, live Ayurveda. Thank you very much. Namaste.
Thank you, sir. Thank you, sir. It was really a wonderful and inspiring section on the topic, making of an Ayurvedic clinician. So, sir started the section with a powerful message that reminding us that no matter how many degrees or PhDs we hold. We should always consider ourselves as a first year BAMS student. We should always be eager to learn, open to seek more and more knowledge, and continuously striving to become a better physician than we were yesterday. And Sir had beautifully simplified the fundamental Ayurvedic principles, illustrating them with appropriate diseases, examples, and their treatment. And the importance of Vimshati Gunas, Sama Nirama Avasthas, Rodho Dushti, Avarana, Kshaya, and the more importance of modern evaluation. So now it's the time for the question answer section. I kindly request all the listeners, participants, to put your queries in the Q&A section. Now we will take some important questions, sir. So Dr. Rao Gopal has asked, can you just explain modern conditions or diseases as example for period gadi, sir?
I told you, almost all the neurological diseases, all the chronic skin diseases and chronic autoimmune diseases where their distant dhadus are affected can be considered as modern examples. That already I have told. When I was talking about psoriasis only, I came to the Tiryagati. Next question, please.
So next question is on SLE. Can you just put some more light on SLE nephritis?
See, SLE nephritis, Vrka Vidradi Chikilsa. You have to do Vrka Vidradi Chikilsa. You have to think about the Shadavari Girda, Shadavari Kshiravagga, Guduchya Girda, Trunapanja Mula Kashayam. Pittadiga Sannivadam is the main dosha, Dhadu Bhagam is the main event. Treat according to the concept of Vrka Vidradi. Next.
Okay, sir. Okay, sir.
See, you can have my WhatsApp number, and those who are having any doubts, you can contact me. I will be happy to answer. Okay.
Okay, sir. Okay, sir. So with this we have,
that is why,
yes, with this we have come to an end of this question answer section. Now I would like,
don't discourage them. There is no Vada Pradilomata. You can message to me at any time. I will be happy.
yes, sir. Okay, sir. Okay, with most pleasure, sir. So now I would like to call upon Dr. Srinaz BS, Assistant Professor, Department of Panchakarma, to deliver vote of thanks. Over to you, sir.
Thank you so much. Sir, thank you so much, sir. It's a wonderful session. Actually, respected dignitaries, esteemed guests, dear colleagues and participants, I would like to thank our distinguished guests of honor, Dr. B.S. Prasad and Dr. Prasanna Narasimha Rao, sir, for gracing his occasion and sharing their valuable perspectives. Our sincere appreciation goes to Dr. Sunita Yadav, chairperson, and Dr. Shailendra Yadav, sir, our chairman, for her continuous support and encouragement. And here is coming to our main. It's my privilege to deliver the vote of thanks of the enlightening scientific session by Dr.S.Gopakumar, Registrar of Kerala University of Health Sciences. Actually, tell about Gopakumar, sir, actually from our first year, when I am joined BMS in 2008, from that time itself, sir is our role model. Role model means why? Because we are attending many classes from sir. His talking style. From starting, I am I am waiting for the ventricle word. Normally, sir will use that from our left ventricle. That word sir will use in every speech. So I am waiting, but finally, in the last sentence, sir completed with that word. So that is the main highlighting sir speech. So from that beginning only, when our BMS time, we are giving more knowledge from these gurus, especially our Gopakumar sir, L. Mahadevan sir. These people are our more mentors. They will give the guidance. That's why the same concept now we are applying, and how we are treating also is because of this enlightened our very great gurus like Gopakumar sir only. So I am very much thankful to you, sir, because his busy schedule. Actually, from December, I'm trying to start to actually calling sir, but sir is too much busy. But at last, sir is agreed for these classes. Actually, 5 o'clock, I think, sir. Another some commitment is there. Still, sir is here with the 15 minutes over. So I am not making more big. So I am giving much more thankful on behalf of Shri Babu Singh Jai Singh Ayurveda Medical College and organizing committee Prabodhini webinar series, and all present, I extend our heartfelt gratitude to our Gopakumar sir for his insightful and thought-provoking session on making of an Ayurvedic clinician. His vast experience as an academician, researcher, and leader in Ayurveda, along with his dedication to advancing Ayurveda education and clinical practice, has truly inspired us. The clarity and depth with which he addressed the challenges and opportunities in shaping competent Ayurvedic clinicians will undoubtedly benefit both practitioners and students alike. A special mention to the organizing committee, Dr. Preedimai Sau, Dr. Niharanjan, and myself, Dr. Shinaz, and the technical staff for all this seamless coordination. Especially our principal sir, Dr. Manjunath N.S. sir, is a backbone to all our program, and vice principal, Dr. Ratendu Rambao sir, they are giving all this support for this program, the smooth conduct of this webinar. Also, we are like to thank all the participants. They are the main for this webinar. They are continuously giving the support and the dedication. That's why we are conducting this program. So I would like to thank all the participants to the webinar, and let us carry further the insight gained today and strive to uphold the standards of excellence in Ayurvedic education and clinical practice as exempted by Dr. S. Gopakumar sir. Thank you one and all. Thank you.
Thank you all. Thank you so much.
Sir, thank you.